I done my placement in a busy pharmacy. On the first week of my placement, a lady came in with baby on and asking for Nilstat oral drop. I want to ask some questions, but she refused to answer anything and just mentioned, please give me oral drop Nilstat. I dispensed the medication and I gave her, and when I want to counsel on it, she mentioned she know how to use as her doctor already give the direction. On the next week, she came back, she was nervous and asked me another Nilstat drop. And I just dispensed and give it to my preceptor to check it. And I discussed the scenario to my preceptor from last week incident. So she mentioned, do you know how old is her daughter? I didn't know, but the mom replied, she is 9 weeks old. So my preceptor then taught me to how counsel Nilstat for infant. I went back to the mother to inform her that how to use the Nilstat infant, and she should use her finger to use the drops in the baby mouth, as baby is not capable to keep the medication in their mouth or swish it, and baby just swallow it. But she just yelling out and mentioned, you mean my doctor is wrong? You mean my doctor gave me a wrong direction? I was so embarrassed and I was so stressed because the people around her were just watching us. So I didn't know how to justify her. And just my preceptor overheard our conversation and came to us and just solved the problem. I have had this experience on oral Nilstat drop on my previous placement. However, the patient was adult and he was willing to know how to use the medication. So I just counseled it and mentioned, put the medication in your mouth and keep it as long as you can and swish it around the whole mouth and all inside the cheeks before swallowing. According to the NCSF, for pharmacists in Australia, Domain 2.3 focus on maintenance and appropriate style of communication in difficult or stressful situation, communication in calm manner, and demonstrate composure in situation where tension, conflict, and emotion arise. The reason why I found these incidents very important: first, the mother refused to answer my questions due to her nervousness, and second, she just relied on her doctor. Poor communication between the mother and me, and also lack of my knowledge on Nilstat using in infant leads to treatment failure. In first encounter, I had to guide her to some more private place and just help her to calm down, to saying your daughter well-being is important to us, and assure her that her doctor was correct in prescribing Nilstat oral drop. However, according to Nationwide Children in Infant, cotton tip swab or finger should be used instead of syringe. And this is just because the infant is not able to keep the medication in their mouth or swish it around all inside the cheeks and maybe just swallow the medication. In future, now I know how to communicate with people because I know individuals are different. Some patient may willing to answer my question and share their medical history, while some patient may refuse to answer my question and maybe not collaborate and share their medical history. And this is due to any reasons. Thus, this is my responsibility to help my patients in any situation. Thank you.